I'm Tom LeBlanc from the Duke Cancer Institute. I'm a leukemia specialist, palliative care physician, and patient experience researcher. Much of my work focuses on the patient experience of acute myeloid leukemia, or AML. And one of the areas that we've been studying recently is what it's like to be diagnosed with this illness and then to receive a high dose intensive induction chemotherapy, as we often call it. And questions come up frequently about what that patient experience might be like. And we do know from published literature that intensive induction chemotherapy is associated with some significant patient experience impairments. For example, significant symptoms, issues with quality of life impairment, physical function impairments, but also significant symptoms like anxiety and depression, so what we might call psychological kinds of symptoms, from being stuck in the hospital for the 4 or 5 week period that is often typical of intensive induction chemotherapy. And what we've learned about these patient experience impairments, of course, makes us wonder how we might improve upon the patient experience of high dose chemotherapy in AML. If that is the best and right treatment for a particular patient in their situation, how could we make that a less difficult experience? How could we improve that overall experience? To do this, we have recently been studying whether integration of specialist palliative care into the leukemia treatment team might improve the AML patient experience of high-dose chemotherapy. And at the 2020 ASCO Annual Meeting, my colleague, Dr. Arij Al-Jawari, presented some evidence to this effect from our randomized clinical trial that we conducted at 4 sites in about 160 patients, showing that integrated specialist palliative care can significantly improve patient-reported quality of life 2 weeks into that difficult high-dose chemotherapy hospital stay, but also even at 24 weeks later, and that it can significantly improve anxiety and depression symptoms and reduce post-traumatic stress symptoms in these patients with AML getting high-dose chemotherapy who receive specialist palliative care. Many folks ask, though, what that really means, what that actually looks like. So specialist palliative care in the context of what it can do for improving the AML patient experience really focuses mostly on symptom assessment, symptom management, getting to know a patient and family very well, building rapport, helping to understand their goals, their objectives, their overall experience, their symptom burden, and then helping that patient and family with coping with the challenges of being stuck in the hospital during that prolonged hospital stay. And at this year's ASCO Annual Meeting, we've presented a follow-up analysis looking at this specific issue around coping. And we found actually that a big part of how this integrated specialist palliative care intervention helps patients with AML to feel better is that it helps them to develop and use more positive coping styles instead of more negative ones. And so palliative care specialists can help patients to not do the negative things like to be in denial about their diagnosis and to more positively reframe that experience in ways that can help them feel better overall in their quality of life and having fewer issues with anxiety or depression symptoms. We still have a lot more to learn about how to best integrate specialist palliative care into the AML patient experience. We have not yet, for example, studied this in patients receiving low intensity therapy or patients receiving this kind of new leukemia treatments that are often given outside of the hospital, combination therapies, more targeted therapies. But at least in the context of hospitalized patients getting high-dose chemotherapy, we now have pretty good evidence that integrated palliative care really can significantly improve that patient experience and really should be a new standard of care that we can provide with high-dose intensive induction chemotherapy in AML.